Hey, what's up, everybody? It's Kenny Lamons here with Medicare Millennials. And today I have brought back Todd Tippets from Manhattan Life. And I promise you, today is going to be a very practical and useful video. So, I've been on a journey for how to take my T65 Medicare business and go deeper with them instead of going broader. So, instead of trying to sell plans all over the country and compete with call centers or sell other lines of insurance, I want to go deeper with my book of business. What I've found is I don't like having to sell 30 different companies as I go deeper with my clients. So I've been on this journey to kind of hone in on a handful of companies that provide the type of products that are going to benefit my clients. And I can have a relationship with those carriers instead of just having a ton of different contracts. So, along with some other things, Manhattan Life's repertoire of products has been very useful for me, whether you sell ACA, Medicare plans, under 65 health, or even in the MIGA market, they've got a suite of products. My number one favorite thing about them, as I'm actively learning, is their quote and enroll software, where I can generate quotes, illustrations for multiple products all in one space. Now, with all that being said, we're just going to focus on their Hospital Indemnity Select plan, which Todd's going to speak on momentarily. What is unique about it, because we all know you've got your Heartlands, you've got your GTOs, got your Cignas, your Mutual of Omahas for hospital indemnity. But what makes Manhattan unique to me, for one, is they're not so big that you can't just call in and talk to people. But the other two things are their availability of other products you can quote all in one place. And then what Todd's going to talk about today, which is a matching tool for what Medicare plan you're selling automatically is matched up with the benefits that you want it to put in there with their quoting tool. So we're going to talk about that today. Todd, if you want to just briefly introduce yourself and then kind of talk about the background of this particular product, and
Yep.
then we'd love to see you in action in some way. Show us how this tool works practically.
Awesome. Awesome. Thank you, Kenny. And good morning or good afternoon to everybody, depending on when you watch this. We are really excited to be here today on this Medicare Millennials podcast. And just really appreciate the partnership that we have with you, Kenny, and with your organization. Thank you for those kind words. We believe at Manhattan Life that we really offer one of the broadest portfolios of products for agents like you to go deep into your book and to provide great bundles of protection for your clients. Because agents continue to discover as time progresses that the deeper they go with clients, the longer those clients stay with them and the more stable their revenue streams become because of that persistency and that breadth in product revenue. So I think it's a perfect alignment of everything you just said in terms of the opportunity in front of us. So thank you for that. And again, thank you for the invite. We are delighted to be here from Manhattan Life. And today, as you mentioned, we're going to talk about our exciting Hospital Indemnity Select product. This product just was launched last year in 2024. It is taking the market by storm. Agents are loving it. We continue to roll out more states each week. We rolled out 3 additional states this week. We've got 3 additional states coming next week, and we plan to have probably by midsummer, somewhere in the neighborhood of 40 to 45 states. Right now, we're at about 25 states that are available. So it's a pretty exciting thing, and we can go into that detail as well. So let me tell you why we believe this product is unique. And then I'm going to do a demo about the quoting tool and some really cool features we have for you to work with this tool and your Medicare clients. As you mentioned, there's a lot of choice out there, Kenny, for hospital indemnity plans. When we did our research, we did not see very many options that truly were full hospital indemnity options that could cover anyone from kind of the age of adulthood, age 18, all the way up to the grave, age 85 plus sort of thing. So we've got a plan that we've designed that is really available for individuals between the ages of 18 and 89. It includes where you could buy individual coverage, spouse coverage, or even family coverage and cover your kids under the age of 18. And we designed it as a wraparound product for where the client is at in their life. So there's two different parts to our product, Kenny. The first one is for the under 65 population. The base plan that someone would buy with the Manhattan Life Hospital Indemnity Select plan is a 1-day hospital admission benefit. And we've made that where you can pick anywhere between $50 and $10,000 for that one-time hospital admission benefit. Why have we done this? And this is not something that we've seen with any other carrier out there right now. It's because a couple of things. The number one reason is there are high deductible health plans out there now that have huge out-of-pocket expenses. And why do people hit their max out-of-pocket? They have an unexpected hospitalization during the year. So whether it's an ACA plan that has a max out-of-pocket of $9,200 here in 2025, or whether it's your neighbor down the street that works for XYZ company and has a high deductible health plan at work, this could be a great thing that you could provide to them as extra protection to cover them and protect them if they were to have an unexpected hospitalization and really have expenses that could hit that deductible in their plan. Okay, so that's the under 65 version. The over 65, if you're 65 and older, technically it's 64 and a half and older because those are the people that are getting ready for Medicare. They're going to purchase a base plan that is designed as follows. You're picking a hospital copay plan. So that is either a 3, 6, or 10-day hospital copay plan that pays $50 to $750 per day that you're hospitalized to help you cover those costs that your Medicare Advantage plan is going to have when you go into the hospital. Okay. Both plans, under 65 and over 65, reset every 60 days. So if you were to go into the hospital, your benefit would be paid. If you're out of the hospital for 60 days and go back in for a new admission, the full benefit would pay all over again. And so literally, this benefit could pay up to 6 times a year with that 60-day reset on the plan. The final really cool feature I want to, or I guess I'll add 2 more really cool features that I want to talk about before I go into the demo. The first one is for those that are turning 65 and in the early years of Medicare, this plan is guaranteed issue for those between 64 and a half and 70. If you're in that window of time, guaranteed issue, no underwriting. If you're outside of that window, this does go through what I would call typical underwriting questions. Okay. Also, we've added some pretty cool features that make us unique from some of the other carriers out there. We include ambulance transportation benefits as part of the base plan and not as a rider. And we include also urgent care and ER visits as part of the base plan. Okay. Awesome. That is not part of the rider that you might have to buy with other carriers. Additionally, we provide coverage for observation. That's been a big kind of tactic from hospitals, I guess is a good word to use in the last 10 or 20 years. You'll go into the ER, you'll stay a day or two, but you never technically get admitted, and some plans will not pay a benefit for that. This plan pays for hospital observation stays as well as paying for a full admission to the hospital. Okay. So those are really the features about this plan. I know that's a quick level summary, but I'll get ready to do a demo here and share my screen. As you've spent time, Kenny, just as a chance for you to think about as you're working with clients, etc., did that quick overview bring up any questions in your mind or anything that you'd want to make sure that I cover as I'm getting ready here to do a demo on how to quote and sell this product?
No, other than just the fact that the guaranteed issue goes up to 70. That's kind of a must because it
Yep.
makes It makes it much easier on us as agents on wait, or that gives us a broad range to know we can get our clients covered. So thank you for saying that. I love that the ER and urgent care and ambulance are just a part of the product. They really
Yep.
should, that should just be a check the box. Those three things are covered. And I'm assuming you'll show us where we can add an outpatient surgery copay coverage, though.
Correct. Correct.
Yep.
And a skilled nursing. Correct. That's a great question you kind of embedded in your comment. There are three riders that we offer. One of them is an outpatient copay rider. There's a skilled nursing facility rider. And for people over age 65, there's also an additional admission benefit rider that you can add in addition to the daily hospital copay.
Got it. Nope, that's perfect. Let's jump into it because this is the good stuff, just showing them
Yeah,
how it
perfect.
works.
All right, well, let me go in here and share my screen. All right. Is that showing up on the screen now?
Yep, we got it.
All right, so for all of you watching today, I am now logged into the Agent Resource Center, which is the one-stop shop for agents at Manhattan Life. When you get a writing number, you get an account set up. This
If
is
you
where you
don't
can.
have a contract with Manhattan, just reach out. You can reach out to Manhattan directly. They'll direct you accordingly, or you can reach out via my website, Medicare Millennials, and I'll connect you. Make sure you get set up with a contract. So, yep, go ahead.
Perfect, perfect. That's great suggestion. And once you get in, this is your dashboard to your one-stop shop. And we do trainings on this portal. You can get materials. You can download applications. You can see videos. You can do training. You can go to Enforce Business and check your book of business. You can go into commissions and check your commission statements. It's really got all the information you need, including our training schedule. So the button that I'm going to be focusing on today is the e-application or our quote and enroll tool. By doing this, you're going to have an incredible tool at your fingertips that I'm going to show you how you can go deep with your clients. So once this gets launched here, it brings up the quoting portal. And once it launches, it just has taken a second here, probably because we're doing the recording. That's just how Murphy's Law works.
No problem. Come on, come on.
That is just how Murphy's Law works. All right, let's see here. I'm going to try a refresh.
At least we know the website's not down, so we'll get there.
That's right. That was. Okay, see, I just needed to refresh. It was hung up. All right. So once you're at the quote and enroll screen, you go to the quote page, and this is how easy it is. So I'm going to go in, and let's assume that you have a client in North Carolina, okay? And they live at zip code 27707. They live in Durham, North Carolina. You just literally put in their zip code, and then all it's going to ask you is their date of birth and their gender. So I have a perfect scenario that I'm sure you as agents deal with very commonly. Let's go ahead and pick someone here that was born in May of 1958. They're 66 years old. They just kind of got through their last year of work and they've decided to retire. They're meeting with you. They're picking their first Medicare Advantage plan. And so you put that in. And what's pretty cool about our tool is all you've done is a zip code, a date of birth, a gender. You click on view products, and it's going to bring up an Amazon shopping experience for you, which it's now showing you as an agent set up with Manhattan Life in North Carolina. You have 10 products that you could sell to that 66-year-old in North Carolina. You could do a dental vision hearing. You could bundle it with a home health care plan, a final expense plan. You could go to our Hospital Indemnity Select. which is what we're going to focus on today. So I just wanted to kind of give you that background, but it shows you everything that you can quote. Okay. We're going to click on the Hospital Indemnity Select since that's what we're talking about today. Now, I shared with you that we're guaranteed issue for 64 and a half to age 70. This question pops up if somebody has a birth date that makes them 64 and a half to 70. You answer yes, and that means it's their first time applying, and so they will have no underwriting questions. Now, I want everybody to pay really close attention here. I don't get excited about technology too much, but this is really the purpose as you invited me, Kenny, today. The tool then immediately has you as an agent confirm what Medicare Advantage plan have you put them in, okay? If they're in a Medicare supplement plan, you just press cancel and then you can do the quote for them, okay? But if then they're in a Medicare Advantage, it is immediately pulling all of the MAPD plans that are available in Durham County, North Carolina, okay? So let's just pretend, and what's really cool, you can see about this, we do the very small carriers there, like Experience Health, Troy Medicare. Let's pretend that you put them in a Cigna Healthcare plan, and the Cigna Healthcare plan that you put them in was the Cigna True Choice Medicare PPO plan, okay? So you just literally select that, you press then, once this finishes its thinking, this must be because I'm sharing my screen here. Okay, then you click confirm. And then I want you to see here on the right-hand side of the screen, we have gone out to the CMS database. We have pulled in all of the cost-sharing information for the Cigna Healthcare True Choice PPO plan in Durham County, North Carolina. And all of that data is here for you on the right-hand side. Now, we've still made it even easier for you as an agent because then the tool automatically looked at everything on the right-hand side for that plan, and it has automatically built a hospital indemnity plan for you that covers all of the out-of-pocket expenses for your client's MAPD plan.
That's so
Okay?
big because, like, personally, I've messed up before and forgot about an outpatient rider, right? Like, I forgot to add the outpatient benefit for whatever reason. And that it came back and bit me in the butt. My clients were really upset. And I've also, like, in my head, I've got my plans confused and I've put too much or too little of a daily copay benefit. So this just saves you a lot of time of alt tabbing and moving around, checking different websites. Uh, I love it. I love that it
Yeah.
just matches it up for you. Even if
Yeah.
it didn't pull the data, just the fact that it's listed right there next to you that you can double check is good enough. But that's huge. So
Yeah. So it has it all there. And so you can see here, like, look at this Cigna plan charges $290 a day copay for days 1 through 6 in the hospital. So we have automatically picked a 6-day plan at $300. Okay. The Cigna plan charges up to $315 a copay for an outpatient visit. So we've automatically added that rider at $500 to cover that amount. And then skilled nursing, it's $10 for days 1 through 20, but we focus on the high expense, which is $214 days 21 through 60. So we've added that skilled nursing facility for days 21 through 100, that rider at the maximum available amount at $200. So we have built a plan that you could tell your client your $0 premium Cigna True Choice PPO MAPD plan has these expenses, but for this plan with Manhattan Life for $53.90 a month, you now have a plan that will cover all of those expenses with your Cigna plan.
perfect.
Okay. Now, let's say that they want to look at the brochure. You can literally click on the brochure right there. It downloads to your machine. You click on it and you
Well,
can
we're
show them the brochure.
Where that's really practically useful is especially for phone agents who are really, maybe it took them a long time just to present and get the Medicare Advantage plan done, and they either ran out of time or their client is just unsure if they want this plan. You can really quickly quote them And you don't have to go chase down the brochure. You can just download it from the quoter and send it directly to them. So,
Yep.
from a practical perspective, this is really, really useful for virtual agents as well. So,
Exactly. So you've got that. If they really are excited about this plan, but their budget is $40 a month, that's very easy to manage. You can just say here, you know what? Let's look at what it is at $250 a day for the copay. And you just kind of make that tweak, and we brought it down to $50 a month. You could, bring it down to 200. And so you can just kind of show them, you can tweak it. Maybe they want to pay a little bit more and get $400 a month, a $400 daily copay in the hospital. So you can still tweak it even after it does that automatic quote.
got it.
Okay. Let's pretend that you make a mistake because you've been working with 20 clients today and you go, oh gosh, Mr. Jones, you're not in that Cigna plan. I put you in that Aetna plan. You just go to the Medicare plan at the top. You click on Cigna, go to the download, go to Aetna. You're right, Mr. Jones, I put you in the Aetna Medicare Premier PPO plan. That's the one you're in. That's right. You click confirm. The tool does its magic all over again, and it's built that tool for that person in that Medicare plan that covers everything. So in this one, they have to pay $374 days 1 through 8. So this added the 10-day copay plan at $400 to cover that plan for that individual. Okay. So, and you can just kind of see down the list. And then really, this is another training that we do maybe another time, Kenny. But again, if you're trying to do a package of protection, you might offer them an accident plan where they're getting extra benefits if they get injured in an accident and go into the hospital. And that covers them at $15.50 a month. You add that to your shopping cart, and you want to sell them a cancer plan because their dad died of cancer and they know that they need a lump sum cancer plan, and you sell them a $20,000 lump sum cancer at $64 a month. This is how easy it is to bundle with Manhattan Life. You go to your product list, it shows you on the right-hand side the 3 products that we've added to the shopping cart: Hospital Indemnity Select, accident insurance, lump sum cancer, a grand total of $149.48 a month. When you click on begin enrollment, you're doing one application then for all 3 of those products with Manhattan Life.
That's beautiful. Honestly, that is that is what I said at the beginning. One of the reasons that I was like, okay, I really like Manhattan. You just don't have a tool like this where you don't have to bounce around to different websites for different products. So I genuinely appreciate that. I
Yeah.
don't want this to go on too long. We can always do another video. I think that gives a very clear picture to what separates the Hospital Indemnity Select with Manhattan versus some of the other options. Again, if you're interested in contracting with Manhattan, which I highly recommend if you're a Medicare agent or a health insurance agent in general, you can reach out directly to Manhattan. You can reach out to me at MedicareMillennials.com. I'll get you connected. Todd, any final thoughts on this tool or this product before we wrap up today's video?
I would just say that really, we are really referring to 2025 as the year of the bundle. It is time for agents to go deeper, as you really kicked off this call with your clients. And it will help them, it will help you as an agent, and it will help them at their time of need when they need it most, your client. And so really just thank you for the invitation. We're excited to be here for all of you and to help you grow your business with Manhattan Life. So thank you very much.
You're welcome, man. Hey, that was awesome. We'll talk to you soon. Thank you for the presentation.
Thanks. Bye-bye.